Hello, this is Dr. Mike Jennings. I wanted to share with you digestive physiology, how things are supposed to work, what happens when this mechanism breaks down, and the pain, suffering, and agony that you feel when things aren't working properly. Typically, people don't think about their digestion unless they're having symptoms and it's causing them problems. So, first thing, you need to understand how things are supposed to work and what happens when this process breaks down and what you need to do to actually correct it properly, not just mask the symptoms. Of course, digestion is the breakdown of food from larger and larger particles down to a smaller particle to where your body can actually assimilate it and nourish itself. It starts in the mouth. We have teeth in our mouth to chew our food and to mix it with saliva. And the reason we chew our food is because you don't have teeth in your stomach. So it's important to slowly chew your food. Everybody knows that. But it's good to have a reminder to do so. As the food passes into the stomach, your body secretes hydrochloric acid. Now, hydrochloric acid is a very strong, powerful acid that breaks your food down into a smaller and smaller particle slurry. As it does this slurry gets to around about 1.5 pH. So when it gets to that low pH, that triggers the release of it 1 teaspoon at a time into the small intestine, the duodenum. In the duodenum, the first part of the small intestine, that is way too acidic for that tissue in there, so that triggers the body to secrete bicarbonate from the pancreas to slightly alkalize that and raise the pH up to about 4.5. So this is called a pH shift, which is what's the most important part of this equation. The pH shift from 1.5 to 4.5 then triggers the contraction of the gallbladder to secrete bile into the small intestine, and also it stimulates the pancreas to secrete digestive enzymes into the small intestine to then continue digestion into the small intestine, and so your body can keep breaking it down into its constituents of carbohydrates, fatty acids, and amino acids. Where this problem and this process breaks down is obviously we don't chew our food good enough. It gets into the stomach, and quite frankly, living in America, our stomachs are hammered with food that's hard to digest anyway, and our digestion typically gets weaker with time, so your body's not producing enough hydrochloric acid. So when you're not having an acidic enough stomach, the food in there is not being broken down. Now, this food sits there in this warm, moist environment, and it's not being broken down to a small enough and low enough pH so it doesn't get passed on into the small intestine. So as it's there not being digested properly, it sits there and it rots and ferments in this warm, moist environment. And as it does the food actually produces its own organic acids and gas. That's the pain and discomfort, gas and bloating that people feel, that they then call acid reflux and just gas, pain, distension, pick your terminology. And what happens is this massive rotting undigested food sits there and it irritates the stomach lining and it gradually erodes it, causing gastritis, which is stomach pain and erosion and inflammation, and also ulcers. And obviously it causes acid reflux to keep coming up into the esophagus, and the esophagus is not designed to handle the contents of the stomach, so it causes erosion there and pain, and that's the acid reflux people have. Now, this undigested mass of rotting food gradually does get passed into the small intestine. But remember I talked about that pH shift of 1.5 to 4.5? Since it was never acidic enough, there is no pH shift. And when that pH shift doesn't happen, you don't get contraction of the gallbladder and you don't get the pancreas to release enzymes. So there is no more digestion going on. So still you have this massive undigested rotting food going down through the small intestine, just irritating the intestines too, causing intestinal erosion and irritation and inflammation and ulcers and all kinds of bad stuff. Eventually it does pass down into the colon with gas and bloating and distension, and you feel awful, and you eventually eliminate it. So this process, what happens when this breaks down like this, it is simply because your stomach isn't producing enough hydrochloric acid. When your food is broken down through proper acid from the stomach, all just happens naturally and you don't think about it. It's because of not enough hydrochloric acid. The acid that people see on TV and the proton pump inhibitors and the purple pill and the Tums and all this stuff that they are neutralizing the acid from the food that's rotting. It's the organic acids of the food that is rotting, not because you have too much hydrochloric acid. And the reason you have these rotting acids from the food is because you don't have enough stomach acid, hydrochloric acid. So they come in here and they neutralize everything, which does help with the symptoms, but you completely now just shut down digestion physiology, and you can't digest protein and minerals and anything else for that matter. So it leads to all kinds of health problems because of that, as you can imagine. Now, what you need to do, Number one, where we step in with things is a lot of times when people are having digestive problems, they're having a lot of pain and suffering and agony, and they just feel awful. So we have to put out the fire first. Number one, I give them a product called Gastrex from Standard Process. Gastrex, I have people take 4 pills, pull them apart, and put them in a glass of water, stir it up, and down the hatch. What this does is this coats the esophagus and the stomach to help put out the fire that's going on there. Gastrex is named after gastritis in order to put out the fire in the stomach and help that heal. Number two is chlorophyll complex. Chlorophyll complex, I have people take 2 little pearls and bite them and then actually swallow the chlorophyll and spit out the pearl. What that does is the same thing. It coats the esophagus and it coats the stomach. It's very good at putting out the fire that's in the stomach. And number 3 is a product called HiPep. HiPep is from MediHerb, and that is specifically designed for gastritis and ulcers. And it just is really good at calming inflammation and pain in the stomach. And last but not least, when it comes to pain, MediHerb has a product called Boswellia, and Standard Process has a product called tuna oil. These are the best at anti-inflammation and pain reduction globally across the body. When you use them for digestion, it just calms down the inflammation in the gut. Now, what the goal is to get digestive physiology working properly. That is putting out the fire. The next steps is getting things turned back on so they're working properly. We give people a product called Digest Forte from MediHerb. Now, what that is bitter herbs. Bitter herbs stimulate digestion to work properly. It is like plugging in a Christmas tree and the light bulbs pop on. The receptors in the digestive tract come alive and they start producing, your body starts producing its own digestive juices the way it's supposed to be. So Digest Forte, 15 minutes before you eat, I actually have people suck on one, and that tells the system, get ready, food's coming. So your body can start producing the acid the way it's supposed to and get the enzymes ready and get the bile ready and everything else. While we're doing that and supporting the system to work properly, I actually supply the system with some hydrochloric acid. There's a very mild supplement called Zypan, which is hydrochloric acid and pancreatic enzymes, and we give that to them 1, 2, sometimes 3 per meal to get the pH of the stomach low enough so it gets down to that 1.5, so your body breaks down the food properly, and then that mechanism works to where it goes into the small intestine and the gallbladder is triggered, the bile is triggered, the pancreatic enzymes are triggered, and digestion works properly. If you don't get the pH low enough, the whole mechanism doesn't work, so we give them something called Zypan. Number 2, we give them something called Enzocor. Enzocor stands for core enzymes of the pancreas. These are the enzymes that the pancreas normally would produce, and what we're doing is we're supporting this weak system that's just pooped out until we can get things stimulated and healed up enough to where it's producing for itself. So we give them some enzymes to help finish that process. Lastly, we do gallbladder support. Because that pH shift never happened from 1.5 to 4.5, the gallbladder typically is not getting contracted and regularly like it's supposed to be, and the bile just sits in the gallbladder, and eventually with time it becomes sluggish and it crystallizes. When it crystallizes, it can form stones, but also it becomes thick and sluggish, kind of like oil in the wintertime in your engine, and it just doesn't want to flow. It's like sludge. So we give them something called beta food and AF beta food, and this allows, it's got a chemical in there called betaine, and betaine thins the bile to where it flows properly and it becomes free flowing to where that when the gallbladder actually contracts, it'll come out versus just the gallbladder cramping and then causing all kinds of symptoms. And if the gallbladder is just too pooped out, which I see a lot, we just give them what I call a gallbladder in a pill. It's called Colacol from Standard Process. It's literally bile salts in a pill, and it supplies the bile for the digestion that your body just isn't getting out of the gallbladder at that time. So there's lots to do for this mechanism, but number 1 is getting it calm down the inflammation and pain. Number 2, getting digestion stimulated and turned back on. That's the Digest Forte, supplying for the body what it's not yet quite ready to supply for itself between Zypan and Enzocor and the gallbladder support, and then this allows this normal digestion to gradually come back online to where it's working properly. This is not a hard thing to do, but you have to do the right things and support physiology properly, because if you just take the purple pill and your acid blockers and stoppers, you're going to completely shut down your digestive physiology. You can't break down protein and minerals, and you're just going to become even unhealthier as a result, because we have to break down our food in order to assimilate and rebuild ourselves and allow ourselves to heal. If you are a local patient, all you have to do is stop by. I've done this a million times. I will help walk you through this. You do not need all of these products. We will find out exactly what you need and just support your system with the ones until your system's back online the way it needs to be. If you are not a local patient, just email me. You can email me at drjnutrition@gmail.com, and I will talk with you over the phone, and we can converse via email, so forth and so on, and I will help to guide you through this. So if you are having digestive distress and pain and suffering, and if there's just not a whole lot of answers out there, this is not a real hard thing to address once you understand the actual physiology behind it. But almost everything everyone's being taught, between the stuff in the papers and the TV ads and everything else, is completely the wrong physiology, and they're doing the exact opposite of what you need to do. You need to turn digestion back on, you need to turn your hydrochloric acid back on, you need to turn your bile flow back on, and your pancreatic enzymes. And when that happens, then digestive physiology works properly, and you're just a normal person that eats food. So if you would like my help, just email me at drjnutrition@gmail.com. Thank you for listening.